The Birth Circle podcast features experts in all the nuanced areas of pregnancy, birth, and postpartum with the aim of helping women make the choices that will keep them safe, healthy, and empowered. We respect all birth choices and believe in supporting informed consent and evidence-based practices. Nothing said on this podcast should be taken as medical advice. You should always seek the advice of a competent professional for your care. Welcome to the Birth Circle podcast.
This is Sarah with Birth Circle, and today I'm so excited to have Dr. Laurena White with me. And Dr. White has over 15 years of service and experience in the field of women's health, ranging from birth doula to physician, including acupuncture and Chinese herbal medicine. She's worked closely with a team that she's carefully chosen to deliver expert care not only to her patients, but also couples trying to conceive. Together with her team, Dr. White facilitates the transformation of complex women's health and fertility challenges. By helping women and couples address the underlying root cause of their condition, her patients begin to flourish without taking unnecessary pharmaceutical medications or having fruitless, invasive surgical procedures. Dr. White has developed purpose-built signature programs that are unique to her Eudaimonia Center. Thank you so much for joining me today.
Thank you for the invitation. I appreciate it.
Oh my goodness. I'm so excited to nerd out with you because you've got the Western medicine with the Eastern medicine together,
Yes.
and you manage that. So
Yes.
I know I'm
So
super
on
excited.
some days better than others, but yes.
Got it. Well, I mean, it's such is life, but I'm just so excited to pick your brains. So first of all, tell us about your background. How did you get into this field in the first place?
All right. Pretends on like how far you want me to go back, but I'm just gonna be honest. I think I wanted to be a physician probably before like I wanted to do anything else. And if you look at all my baby pictures, I'm either have a baby underneath my shirt and I'm pregnant or pretending to be
I love
pregnant,
it.
wanting to be mom, and a stethoscope around my neck.
So you
I had
identified as a birth provider way
Yeah,
early.
like from the get-go,
I love
probably
it.
like early signs of something like else going on, like that I want to be pregnant, and I was like just barely out of the womb myself. But anyhow, yes, I definitely knew I wanted to be a doctor. I knew I wanted to be a mom. And then my mom's like, would always ask like, well, where's your husband? And I was like, I don't need a husband. I need, it's my baby, and I'm going to work. Um, and so as I got older, I still knew I wanted to be a physician, and I thought I wanted to be a pediatrician. And in terms of pediatrics, I loved the rotation. I loved the children, but I did not like their parents. And that was a drawback, just because I felt like I was powerless in so many ways. And there were so many helpless children that I felt like I was sending them sometimes back to the wolves in terms of the care that I was providing and then what was needed to be continued at the home. So as I went through all my rotations, during this time I had been a birth doula, labor support doula, and I loved it. We always had women's circles in our family, rituals and ceremonies around womanhood. So that was just a part of my cultural upbringing, all the way from my great grandmother all the way down to my mom, myself, and my sister. And so that was amazing. That was just a tradition that was a part of my life, and I didn't know it any other way. And so women's health and just women's ceremonies and rituals and just a spiritual connectedness was just a norm for me. And so when I got to my women, OB-GYN and obstetrics and gynecology rotation, it was really exciting. But I was like, I don't want to be a gynecologist because I don't want to look at vaginas all day. Like, who signs up for that? Um, but I didn't really know at that point exactly what I wanted to do because I knew pediatrics was not it. So I kind of just lucked out, and by the grace of God, I got my OB gynecology, the OB part of the gynecology OB-GYN rotation first, and it was love at first sight. My thing is, I don't want to be anywhere else. I don't want to do anything differently. I don't want to do anything but bring life and participate in this miracle. And that was amazing. It was fun. And by the time I did get to my gyne rotation, it was just a matter of, oh, this is why I'm here. This is about education. This is about community. This is about overall health and well being and preconception care and just teaching women about their bodies and the temple that they have that resides within themselves. And it was beautiful. It was miraculous. I fell in love over and over and over again each day. And that's when I knew, okay, this is what I want to do for the rest of my life. Um, as I moved on, I kind of got just a little bit dismayed and about how healthcare is in the United States. And it was a matter of not seeing the level of accessibility, the level of appropriate care, the level of affordability, the level of just acceptability among different populations. And I was just like, I
Yeah.
can't. And that was kind of disheartening. It was frustrating, especially on a day-to-day basis when I felt like I'm showing up to work, but nobody's getting better. So I had the opportunity when I was finishing my capstone project to examine healthcare systems across the world. And so I had traveled to Europe, I traveled to South America, I traveled to Mexico. Um, and at the end Canada, and I at the end I had the opportunity to travel to Cuba, and I wound up living in Cuba for 6 years, after working for the Ministry of Public Health there and really studying their healthcare system and realizing, oh, this can be done and it is being done. And if a third world country that doesn't have near as much technology and resources, human and capital otherwise, then this can be done, and it doesn't have to be this over magnanimous thing. It can be practical, and it just needs to be put into place.
You mean they were combining what made their system different than ours?
Oh, because again, for example, the first time I had acupuncture was in Cuba.
Oh,
And when I
interesting.
had my physical, they do a traditional physical. They go through all the Western diagnoses and the conventional therapy and things that you need. However, immediately afterwards, you have an acupuncture appointment. And I didn't know what was going on. I wasn't sure if they had made a mistake or what was going on. But then I realized, oh, this is a part of it. This is the whole body
Mm,
treatment. This isn't just
got it.
treating my physical symptoms or lack thereof, but also my mind and my spirit. And it was beautiful. And I remember leaving that appointment thinking, what just happened here? Because I know I felt differently than I've ever felt after leaving the doctor. And I felt lighter. I felt like I was floating. It was just an amazing experience. And I was like, this is what I want to bring to my patients. And by the time I finished that, the earthquake in Haiti happened. So I went to Haiti and I lived there for 2 years. And by the time I got back to the US, I was just so fired up and ready to go. And like, okay, yes,
Yeah.
I'm going to like change everything, and everything is going to be different. And my patients are going to be just awesome. And I quickly realized, yeah, the system isn't designed for that. It's not
No, it's totally
designed
not.
for a whole patient perspective. And I think we're moving in that direction. But even now, there's just so many gaps and so many different levels that are not being tapped into. And so when I got here, I was like, working in a private practice and excited and like, okay, this is what we're going to do. And at that same time, they were starting to incentivize patients and physicians if they could get their appointments under 15 or 18 minutes.
Oh my
And my
gosh.
patients and my shortest appointment on a great day was over a half an hour. By midday, I was already behind because I wanted to, really talk and understand what was
Yeah.
going on, and not just write a prescription and on my pad and be gone. And so it was disheartening that I'm working in a system where the things that I know and need and want and desire to be done through me and with my patients was just not. It was like trying to fit a circle in a square peg. Like it just wasn't going to work.
No.
Um,
And
and so that was,
you were having to take insurance. I mean, some of these
oh
things,
yeah.
it's
Yeah.
it's not just you wake up one day and you're like, "I'm going to be an enlightened health provider and I'm gonna have
No,
hour-long appointments." No, the
no,
system, like you said, it's not built for it because, uh,
it's
um
not incentivized. Quite frankly,
exactly.
this is a disease management system versus a healthcare system. And I think
Ouch.
it doesn't necessarily equate to that in terms of dollars and cents, because we're not preventing any type of disease in terms of intention and goal and planning and strategic operations. We're planning to just manage people's diseases until they die from them. And when I decided to become a physician, and I never wanted to be a part of that system, I wanted to be a part of a system where, okay, we're going to work together. I'm going to help facilitate your care, but together we're going to work to see what's underlying all of this. We're going to treat that, not the symptoms, not chasing the symptoms here and there, but we're really going to get underneath everything, figure out what's causing all of these symptoms, and really like start to help you heal, get better, live well, be well. And I just was very dismayed and kind of disheartened, yeah, frustrated, because I wasn't seeing that. I would see patients time and time again, and it was more of, okay, moving from painkillers to synthetic hormones to surgical intervention. And those were the tools that I had in my toolbox. And even after the surgical intervention, the lack of education or the lack of preparation still didn't provide all of the patients with the healing capacity that I knew that they were capable of.
Yeah.
And that was disappointing. And so right around that time, I accepted a job working with the Surgeon General, and that was a great job. I didn't have much patient interaction, but I really got to see how the sausage was made and how things can be done differently, when there's, leadership that is really putting their resources into women's health care and the care of women from all throughout the life cycle, from puberty all the way through menopause. And I think it was really, really shocking to me to see where all the gaps were and how we were not addressing those gaps adequately, effectively, or
Well,
efficiently.
yeah, because this starts in the beginning. I want to later ask you more about the rituals that you grew up with, but
Sure.
I mean, I'm sure you saw women in your practice that didn't understand how their bodies worked. Just they had never been taught from
Forget
the
about how they
get-go.
worked. Like we're talking about the anatomy. Like they didn't
Yeah,
know
they
the
didn't
body
understand
part
and
names,
no,
let alone
oh
how they
gosh.
function. Yeah.
Right. And so how can you have a how can you be a healthcare provider if your person doesn't even know what body they're living in?
What their body is doing and why it's doing it and why it's
Yeah.
betraying them every month around their menstrual cycle, or why it's betraying them because they can't plug into their lives
Oh,
because
I
they're
love that word. It feels
yeah,
like a betrayal when you don't understand. It
yes,
really does. Like if your birth doesn't go the way you wanted it to, it feels a little bit like a betrayal
yep,
when sometimes it's a physical reason in your body why the birth went a certain way and you don't
abs-
understand that.
yeah,
Ah,
yeah.
dang.
Absolutely. Absolutely. Especially when you prepared for it, or you think you've asked the right questions, you've eaten the right foods, you've gone to all your birthing classes, you have a partner, you have a doula, and you still wind up with a C-section, or you wind up with a stillborn, or you wind up with some other adverse outcome or less
Yeah,
than optimal outcome that wasn't even a part of your landscape in terms of things that you were preparing for.
right, exactly. Wow. So, have you faced other resistance? Okay, so you practice completely differently now
Yeah, I didn't even get to
than
that part yet, but go
yeah,
ahead.
okay, keep going. Keep
No,
going.
no, no. And I'll just to wrap up. And so at that level, after I was, working at an administrative level, and the administration changed, and a lot of things in terms of women's health absolutely went south. I was like, I can't stay here because this is not in line with my ethos. There's nothing here for me. My job was changing. My responsibilities were just drastically different, and it no longer felt compatible with my mental health. And just going to work every day became a stressor. And so I was like, I can't go back to private practice. Um, and just I can't stay here. And so the next thing was, it's time for me to build my own table. And that's kind of how the practice was built. Eudaimonia means human flourishing. And I wanted every woman who crossed the threshold of our practice to leave better than she came in. And I wanted her to begin that process of blooming where she's planted so that she could flourish into her own being, into health, wellness, and healing. And we're just tending her garden until she can tend it for herself.
Oh, I love that, and you're giving her the tools to learn how to tend it herself too.
Yeah, absolutely. Absolutely.
Yeah, because I mean, if you were to help somebody, get understand their body to care for it to avoid illness,
Right.
then that would put you out of a job, but not really, because there's always
There's
going to be
always one.
a constant Good job, security. So, so yeah, as you've set up your center, what type of pushback have you gotten from the medical community?
Wow, that is probably like another whole conversation. But to sum it up, when I opened the practice, I just thought like it was going to be this magical place that everyone was just going to believe in and love. And I think my colleagues were the first ones to really kind of give me the eye opener that they not only did they not believe in the concept, but they didn't really believe that I was going to be able to stick it out that long. A couple of my colleagues were placing bets on how long I was going
Oh
to
my
be
gosh.
in
Well,
private practice
I still have
before I
this like
returned.
unicorn vision of what your practice could look like. So,
Yes,
did you ultimately, spoiler alert, did you accomplish what you were set out to, or are there still things
absolutely.
in
I'm
the
still doing it. I'm
Yay!
still doing
Yay!
it. I'm
Okay.
still here. Yeah, and we're actually in the middle of an expansion, so we're opening up another office. So I would say yes. I
And
feel
those
like there is
coworkers, are
never
they
the target is always moving, so
yeah.
it's not necessarily a destination, but a journey because I don't want this to just be an office here, an office there. I want this to be, you know, the process of revolutionizing healthcare, women's healthcare from the
You want a
inside out.
movement.
Yes,
You're not just
absolutely.
franchising, you want a
No,
movement.
yes, and I want it to
Oh, I love
be
it.
yeah, I want everyone, men, women, physicians, practitioners, you know, statisticians and scientists and researchers to realize like there is power in preventive medicine and there's power in natural medicine and healing and botanical medicine and herbal therapy and all the modalities that we have
Yeah,
here,
that was my
they
next
all
question
have
is,
a
could
service.
you
Yeah.
just, like, rapid fire list off, all of the modalities you can think of that you employ in your practice?
Okay. Acupuncture, Chinese herbal medicine, yoga, massage therapy, pelvic floor physical therapy. We have a doula collective, midwives, um, vaginal steaming, raindrop therapy, gua sha, Thai yoga body work. I'm
You
missing
used
a lot.
homeopathy,
Cupping, yes, homeopathy, um,
essential oils?
auricular therapy, essential oils, aromatherapy, and dance movement therapy, and prenatal yoga. I think I mentioned that already. And we have
It
2
deserves another
support groups.
mention.
Yeah,
So
we have 2 support groups, for infertility and uterine fibroids.
wow, so plus you use traditional medicine as well. If somebody needs a
Absolutely.
prescription, a good old-fashioned
Yeah,
prescription, then you
yeah.
can write a prescription.
If it's even needed, and I find a lot if when people are receptive to it, they probably when by the time they arrive here, they've either tried everything, and I think we have like a nice even third who are either have tried everything and the traditional or the conventional medicine hasn't worked. They've tried the pills, they've tried the synthetic hormones, they've tried surgical intervention, and they're still in the same place they were with another slew of symptoms and challenges on top of what they started with. Or there's another third that has wants nothing to do with conventional medicine because they either are scared or they're apprehensive about some sort of side effect and they really want to do everything from an integrative and holistic approach. Or there's that middle third who wants to try anything and everything that's going to get them to where they want to be. And I feel like this is where we thrive because we can treat
Wow.
and work with anybody and everyone. And we want to, because I do believe synergistically we're better together. However, there is, like you mentioned before, there's a lot of pushback from conventional medicine communities and that they don't really understand everything that goes into traditional medicine,
Mm.
even though these theories and these practices and these modalities have been out and alive and well and working a lot longer than any of the medicine that we have right now. And because it's all based in plants and the active ingredient in most plant medicine, why not just go to the source instead of creating pills and synthetic hormones that don't necessarily do the job? So
Yeah.
I do believe that there's a synthetic marriage that works best with all these modalities. However, you have to be receptive to it, and a lot of people just are not there yet.
So basically, our healthcare system could model after your center because you're not extreme in your views. You're very middle ground. You pull from both sides So,
Absolutely.
I mean, a lot of people, when they think alternative medicine, they think, dancing naked in the woods in the middle of the night, or whatever, right? I don't know. I mean, you just
Yeah.
think, oh, they're out there, but you're not.
Yeah.
You're saying that you can take the strengths of both sides and put them
Yes.
together and basically whatever's needed in that moment. And so, really,
Right.
what is there
And
not?
honestly, yeah, go ahead.
Well, what is there to lose with doing that? There's nothing to lose, right?
There really isn't anything except for time wasted doing things that don't work. And that is the best way to
Well,
look.
but if you have multiple tools in your belt, you're less likely to spend time wasted on one modality because you've got 50 more you could try, right?
Right.
Versus
And
a
some of them
conventional
work well
approach.
together. They're synergistic and they work so well together
There
so
you
that
go.
you don't ever have to work hard doing one specific thing in isolation because you didn't get. I tell my patients all the time, this didn't happen overnight. Whatever condition that you're trying to modify or heal from or work with, it didn't happen overnight. You didn't wake up yesterday with fibroids. You got diagnosed yesterday with fibroids, but that process has
Mhm.
been happening potentially 10 years in the making. And now you're starting to have the symptoms. But most all disease processes and conditions don't just start overnight and just like, oh my goodness, I have this now, or I have this condition or this diagnosis. And most of the time it's been happening for years, potentially decades at a time. And now, either through years of ignoring symptoms and signs, or years of not understanding why your body is behaving the way it is, or a combination of chasing the symptom and not the underlying cause, you could have potentially be doing more damage than good. And as it evidenced when, birth control is prescribed for women who have uterine fibroids. Meanwhile, the fibroids are just eating that synthetic hormone up like
Mm.
it's breakfast. And it's excited because you're feeding the fibroid and not necessarily treating the underlying cause of why the fibroid exists in the first place.
Ouch. Wow. So your center basically is I'm sure you have an amazing referral rate. Like you're not having to
No, we
beg.
have one of my goals was never to have to do any advertising, because we don't need to, and we provide excellent services. And for 3 years, we have never spent a dime on advertising. We have only used word of mouth and basically our presence in the community. And I feel like that has been one of my goals from the beginning, because I feel like if we can provide just the accessibility, the acceptability, the appropriate nature of the care, and good quality, individualized care to our patients, that is going to speak for itself. That's going to be the consistent factor. That's going to be what translates. That's going to be what patients want, need, and desire, and to be seen and to be heard and to know that their practitioners value them, not just as a patient, but as a human being and as a person. And I think if the healthcare system in general had that approach, one, we wouldn't have so many illnesses and conditions that are hard to manage, but we'd also have a lot more people who are satisfied with their providers.
Okay, I just want to do a little plug here for listeners. If your healthcare provider does not sound like Dr. White, or the practice you're living in does not sound like it's run by Dr. White, you might consider a change. This is amazing. Okay, but do you accept insurance?
We do not. We are a cash-based practice. However, on the flip side of that, any insurance covered service or modality that you receive here, we will super bill and send you that printout at the end of each month so you can get
Mhm.
reimbursed directly by your insurance provider.
I know even when we were very poor college students, it was still cheaper to self-pay and get
Yeah.
care than it
Yeah.
was to try and figure out an insurance plan.
Yeah, and you can still use HSA and FSA funds here. We have no problem with that. It's just that with insurance companies and what they cover and what they don't cover, it limits what we can do and what we know will work. And
Mhm. And then you have to
when
have a full-time billing person to figure it all.
yeah, and it just becomes we spend more time doing administrative activities than actually focusing on patient care. And when it comes to managing complex women's health challenges, you want all hands on deck and
Yeah.
all hands really focused on the patient and not whether this is going to be covered or not, or whether they're going to be reimbursed or not. I want to do what's best for my patient, and I don't want to be limited by what is covered or not covered.
Love it. So, what do you think we could do to shift the birth world, the birth industry to a more integrative approach? Because it feels like there are sides right now. There's still kind of a war going on.
Oh yeah,
We're all
definitely
tired
so.
of it.
Yeah, I mean, it's exhausting, quite frankly. And I think it's again, it starts from the inside out and from the bottom up. I don't think we can any longer expect that the government or that the insurance companies or the pharmaceutical industry is going to lead this charge, because they're not, because there
No, there's no
is no,
motivation to.
yeah, there's no motivation, there's no incentive to keep people healthy. There is an incentive to keep people managed on hormones or surgical intervention or painkillers. And I find that I don't want to live that way. And I don't think most people do, but they feel they don't have any other option. So that's why we super bill, so that the insurance companies can see that, hey, they are being treated for this. This is working, and recognizing the diagnostic codes and what it's being used for, so that there can be a paper trail. And when patients start acknowledging and literally forcing insurance companies
Mhm.
and providers to accept these different modalities as effective and as efficient as a painkiller or a hormone or any other pharmaceutical drug, then we'll start seeing the change. And I think it's going to take work, because it is going to topple everything that we have known that this healthcare system is built
Yeah.
on. And but again, my goal isn't to make the health industry comfortable, but it's to make my patients
Yeah.
well and
Yeah.
whole again. And I think that's, in the bigger scheme of things, I'm willing to, be on the battlefield for in this regard, because I believe in it so much.
Yep.
I have been blessed with my own health and wellness, and again, it's just it's I realize it's a gift, because when I see patients who aren't healthy or who have been struggling or trying to manage a disease process or have a condition that's unrelenting, and they have tried literally everything and spent money on some of the modalities and treatments that are really the ones that I'm like, you did what? You went where? You did for how long? Who told you to do that? Um,
But you never
and they
make your patients feel dumb.
no,
It's
I
all
just
internal
yeah.
dialogue. I know
And I'm
sometimes people tell
curious
us,
though, because I'm like,
"Oh,
wow, there are
dear."
people out there doing that, and that's like something that's accessible. And I never would have even thought that that modality existed, and let alone that people would pay for it, or think that it would work. And it's interesting,
Have
and
you
it's
not heard of ice cream therapy?
I mean, it might as well be. I
I
might
mean,
as well be. I wish. And so yeah, sometimes it's like it's also disappointing to see that there are modalities providers taking advantage of people in
yeah.
ways,
I was gonna say
because
people are a
resource
lot of times desperate because you only
yes,
get one chance at this life, you only get one body, and
right.
so, yeah, man, the industry is ripe for abuse,
Yes.
really.
Wrought for abuse. And I think that is a one of the other aspects that, again, if we can work together, one, you're going to start seeing results within the first month of treatment. Even the most resistant to therapy, because our approach is to do things pretty much differently than the conventional medicine approach is. And it's really down to earth. And I say that not to in you know euphemistically or tongue in cheek, but it really is down to earth. Like,
Yeah.
what are the things that the earth has provided for healing and health and wellness? And our bodies, I believe, and I still do, are designed to heal themselves, but we just have to reteach them how to do those things, because lifestyles and habits and environmental stressors and toxins have kind of helped us undo that
Yeah.
learning process. And so now it's like, okay, let's reteach your body how to heal
There's a
itself,
lot of
because it can.
trust. You're
Yes.
teaching trust in your body and its ability to heal.
Yes,
Okay, so, that
absolutely.
my next question is when somebody comes into you with a you mentioned fibroids, but let's just say
Yes.
it's a general malady, they're miserable,
Right.
they've tried everything. Okay, so they come to you in pain and misery, both
Yes.
emotionally and physically. What are
Gotcha.
the first steps you do with them?
Well, the first thing is we have a complimentary consultation, because I want everyone to know that this isn't about making money for us. And if we can't help you, we're going to connect you with someone who can.
Oh, that's
So the
cool.
first thing is a half an hour. We just sit down and talk. Like, what brought you here? How did you find us? Why are you trying this now? Why are you curious about this approach to care? What has worked for you in the past? What hasn't? Talk to me about your symptoms. When did they start? How have they manifested? How have they evolved? And in that first half hour, we just sit, we literally talk, and I want to get to know your lifestyle habits. What are you doing? What are you experiencing? What are your relationships like? Asking pretty much questions that no one ever asks in all of your time in any other doctor appointment that you've been in. And you will be surprised that so many people say, no one's ever asked me that before. And when I ask it, I'm like, if they've never asked you that before, what have they been doing? Like, how have
Right.
they been treating you? If this super integral question that's to almost basic for me was never asked before. And patients sometimes don't have a response. They're like, I don't even know how to answer that. So after
Wow.
that first half an hour, that gives me, it paints a picture of, okay, can we work with you? Can we not? What is going on? Is this something that is in our wheelhouse? And one thing I don't really do is musculoskeletal issues, things that are like, that's outside of my wheelhouse, unless it has to do with pregnancy or some aspect of women's health. I really don't operate in that wheelhouse of pain associated with necks and knees and hips and
But I'm sure
joints.
you have a great chiropractor you referred to,
Yes,
right?
but we do have a chiropractor on our staff who definitely does adjustments. And again, it's one of those things that I know where my wheelhouse is. I know what this team is about. Everybody on the team has a passionate interest in women's health. So yes, a chiropractor, especially when there's a woman is getting toward her, last months or last weeks of pregnancy, they might need an adjustment or an adjustment ahead of time to get pregnant because there might be some pelvic issues or some pelvic floor issues that might really benefit from chiropractic work or pelvic floor PT. But I know what my strength is, and I don't operate outside of that. This is my lane of genius, and we're really good at what we do here. And so we pretty much, if you're here for a lot of other things that aren't necessarily based in some level of women's health issues, we kindly refer you out. That happens pretty much maybe once or twice a month, not very often. And some choose to like, yeah, but I still want to be seen here because I just like your approach. And again, we really do see everyone, especially once we tell you like we can only get, we don't really estimate that we'll be able to help you. Let's try somewhere else. Some people do, some people don't, but they like our approach. They like the feeling, the
Sometimes they just
atmosphere,
like being heard.
the
They like being
experience here.
acknowledged that
Yeah.
they are in kind of up a
Yeah.
creek. Yeah.
Right.
So, what parts of the birth pregnancy experience do you think are severely over medicalized right now in our country?
From preconception all the way through through postpartum,
Well,
all
that's
of it,
very complete, isn't it?
all of it. I mean, there is no aspect of it that's not. And if you think about preconception care, I can't. I mean, I go to Instagram, Facebook, and there's an I don't know how many different types of things and places and things to go to help with preconception care. And that leads to IVF and all the trouble trying to get pregnant. There's that
Mhm.
aspect. And then it's the, okay, you have, morning sickness and all the things that you need to take and do and be to avoid morning sickness. Sometimes morning sickness is a sign and symptom to pay attention to. And it could be a sign that, wow, things are going well and it doesn't need to be medicalized. And all the way down to labor and delivery. And I think this is where, if I had to pinpoint exactly a point where things are just way, way, way over medicalized and there's way too many interventions, is during labor and delivery. And I tell people all the time, women have been giving birth and delivering outside of the hospital environment for years. Like it's possible not to be tethered to an IV or to
Yeah.
be, on a monitor 24/7. Like these things are novel inventions for safety reasons, but they don't have to be built into every
Yeah.
single
Well,
person's
it feels like
experience.
so many people have this experience just based on the collective fear we have in our
Yeah.
culture surrounding birth.
But we've
So
created that fear. We've created that fear by over medicalizing every aspect of a pregnancy,
so you're
and we treat
basically
pregnancy like a disease instead of a
mm,
natural part of a woman's life cycle, or we treat it like it's a condition. And backing up, sometimes women aren't necessarily in the best condition to get pregnant, so then there's a lot of different aspects of their pregnancy that are not as optimal as they could have been. And I think it just goes back from preconception care all the way throughout postpartum.
Actually, it starts right before, like, as a little girl, right before you get your period, and you're learning about your body, right? And
Yeah.
what you should and shouldn't be doing
Yeah.
to optimize your body for birth,
Yeah.
right?
And a lot of my patients say, no one ever told me this. I don't know where you were when I was getting pregnant because I didn't know that, or no one ever told me this, or they just told us cramps was a part of, your menstrual cycle, or,
Mhm.
oh, heavy bleeding was just a thing that was going to always be. And it, it actually stuns me that I think about the lack of education, not just that our teens, meaning our 15 to 18-year-olds who are, just starting out, but that our 45-year-olds who have 3, 4, 5 kids, and they still don't understand the anatomy, the physiology, the functioning of their bodies, and
Yeah.
how it can function optimally without pain,
Well, and
without
without
excess.
understanding this, you don't have the ability to make choices in labor and delivery
Oh, none.
because
None
you don't know
whatsoever.
what your options are. You don't know how your body works, you know?
Right. Or you're not given the information to make an educated decision based on your current condition. And the C-section rate is evidence that there's just
Mhm.
way too many C-sections that are not even necessary, planned and otherwise. I don't even understand why we're doing planned C-sections just so that you can go on a cruise. Planned C-sections when there's a mechanical or a physical issue, understandable, definitely to protect the life of the mother and baby.
Definitely, a C-section
Yes,
is a life-saving tool. It's
absolutely.
incredibly powerful.
When employed
Yeah.
appropriately. But C-section rates have skyrocketed over the last decade, and I don't really believe that it's because all of a sudden pelvises are just too small for babies
Nope.
all of a sudden. No,
No, not all of
that's
a
just not how it
sudden.
works. No, that's definitely not it. And so it is astounding to see where women's healthcare is, and just the level of interventions between pretty much in a 24 to 48-hour period that a woman undergoes just to bring her baby into the world.
Yeah, yeah. And without having that I mean, I went to a birth recently where the mother kind of did, like, this dance, and she's like, "No, I know." This was, like, her 5th or 6th baby, and
Yes.
she's like, "No, I know that my babies always have big shoulders, and so this is kind of how I feel. I can feel the one shoulder and then the other one move." And she's like she was so in tune with her body that she could actually, like, did a
Shift.
specific dance, a
Yes.
ritual for every baby, and, you know, she had her hospital birth, she had home birth, she had birth center births, but over the course of her childbearing years, she's figured out her body, and
Right.
so she's actually the one to make the best decisions about, what position she should be in right now. And
Right.
yep, that first baby, especially if your mom has never told you stories, if you haven't watched other women in birth, like,
Right.
how would you know how to behave and what to do? And
You won't.
no, I
You
mean, so many
absolutely won't.
times I'm in the birth and I'm the one telling the partner or the other kids, the older kids, "Hey, what
Uh-huh.
mama's doing is perfect. The
Yeah.
noise mama just made, that means baby's coming really soon." I mean,
Really
I'm
soon.
here educating the
Yeah.
viewers of what so that they don't get all, spun up and worried. So, man,
Right.
if we could just okay,
And normalize
soapbox done.
that process. And I think it's some people are concerned when children are in the birthing space. I find it's not traumatic, it's not scary.
No,
It's
mm-mm.
actually very educational that this is what birth looks like. It doesn't look like what you see in that half an hour sitcom where, everyone is great. Someone's water breaks in the middle of the grocery store, and the next thing they have this beautiful, clean baby that is like out and crying and
Yeah.
everything's perfect. Like that's not how birth looks. But it looks very different, but it also is very, very beautiful.
Yep. Well, in siblings and partners, you've seen the videos where, like, a toddler falls and the mom goes, "Okay, good, you're such a superstar, get up," blah, 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 blah," and
Right.
then the kid's like, "Oh, that must not have hurt. Okay, moving on."
Moving
Or
on, yes.
you see a kid that barely touches himself and the parents are like, "Oh no, baby, are you okay?" And then they start crying because 'cause they're like, "Oh, that
Crying.
must have hurt." So I
Right.
feel like birth is the same way with siblings, that
Yes.
parents worry that their older children, even like 2-year-olds, 3-year-olds, are gonna be traumatized by mama's noises or by, like, the blood. They're not. No, no,
Not even close. One,
not
they're
unless you
probably
let
not
them
even
know.
paying attention. And if you're describing and talking to your child with age appropriate words and phrases, and making that experience, oh, this
Yep.
is a good thing. This is mama bringing, your brother or sister into this world, or your brothers and sisters
Yeah.
combination, all these things. Then it makes the situation one that they want to participate in.
Yep.
And when I was a doula, just having, especially at home births, it was a matter of, oh goodness, you can participate by holding mommy's hand, or you can participate by doing this, or looking at,
Getting her a
all the
drink
ways,
or
all
singing
the
her a
ways that you can
song
participate.
or
Yes, all those ways that make this a family affair, all this ways that like put you having your child, your partner, in a critical role to not just start the family when the baby arrives, but you help the baby in the arrival process.
Yeah, and we talk about the magic hour after baby's born, and if you can
Yeah.
have the entire family involved in that experience,
Yes.
and it's not like the siblings get to meet their baby 2 days after they're born. If you can involve the siblings right up front with that bonding, those hormonal
Absolutely.
yeah, that hormonal bath. What
Yes,
is it
all
that
of
we
that.
love about birth? And I'm like, it's the pheromones, it's the hormones, it's just birth
Yes.
smells good. It
Yeah, and
smells
it smells good, it feels good, and
uh-huh.
that whole experience, it can be chalked up to like seeing your newborn, and the air changes, everything shifts, the energy shifts, not just with mom, not with just the family, but with everybody in the room, because something miraculous just happened, and it's
Yeah.
beautiful.
Okay, so now I've got a kind of a hard question for you. So,
Okay, I'm ready.
not everybody gets to come to your center, even though you'll have many locations. But the reality is, not probably in this generation will everybody get to come to one of your centers.
Not in this generation, probably not.
Sorry, the bearer of break of bad news. But okay, so those listening, how can they then take elements of how you view healthcare and tools that you know would work for them if they could come to your center, how do they take those to their current provider and work those in? Like, if I know if you come to a current your sometimes if you come to your provider and say, well, I tried essential oils, they'll be like, oh, that doesn't work. Or if you say,
Mhm.
well, what do you think about acupuncture? My sister said that gave sent her into her labor, post-term labor. Can I use acupuncture? Oh, that's hogwash. So what are some
Mhm.
of the like, are there any phrases or tools that patients can use when they're visiting their current doctors to kind of test to see how open their providers are and if they're on the fence? Because I know a lot. I mean, doctors are humans too, and if you approach them like my way or the highway, of course there's going to be pushback. But
Right.
is there any way that they can approach their providers to try and get more of your type of care with their current provider? Go.
I think that all starts before you choose a provider. And I
Okay.
think in terms of choosing a provider, you need to interview them just like you would interview someone that you hire at your workplace. And the time to find out what their approach is and what their thoughts about things are, but it's before they become your physician
That's
and you've been
perfect.
like you're at
So,
labor and
like,
delivery.
what are some of those interview questions?
What are your thoughts about essential oils? What are your thoughts about acupuncture? I've really read a lot about acupuncture, and I really heard that it's very good with labor and delivery. Will I be able to use acupuncture or acupressure during my labor and delivery? How do you feel about vaginal steaming for cervical effacement and dilation? How do you feel about using yoga? Is there a prenatal yoga therapist that you referred to? And if they can't have any referrals or anything like that, and they're just like, "What are you talking about? Vaginal steaming? I don't even know what that is." Yeah, I mean, there's certain things, if they don't know what they are, if they can't make any referrals, that means they're not comfortable with the modalities. They don't know anything about the modalities. So when you approach them in your third trimester about certain aspects, not only are they not going to be amenable, but they're not familiar with it and they can't
Mm,
provide you any insight.
but
So the time to have these conversations is the beginning.
if you as a first-time mom don't even know what's available, how can you ask questions to know if I mean, because I'm sure that you
Right.
get first-time mamas that accidentally land in your lap,
Yep.
that then you get to just guide through the whole process.
Yeah.
Yeah, she's making a face like that is just the best, right? When you get
It's
to
the
just
best. I love it because I was like, "Oh my
putty in
goodness,
your
you're a
hands.
clean slate. You're a
Clean
clean
slate,
slate
right?
and
Yeah, because I
everything
mean,
there's no preconceived notions about
we say
anything."
go to your provider and ask them
Yeah.
about these things, but what if you don't even know where to start?
What
I
to
mean,
ask.
I'm pretty darn empowered and I
Yes.
don't understand vaginal steaming in as a tool in birth. So that was news
Right.
to me. I'm going to thank you for giving me something to research tonight.
Right.
But So if we don't have any vocabulary, what are
Right.
some of the questions we can ask our provider that will that help us sense if they are even going to guide us, on
That
this path?
main question is kind of has multiple spokes, but that main question is, as I progress through my pregnancy, what other modalities do you advocate for, or are you a
Ooh,
proponent for, that will help my
I
pregnancy
love
be
that.
smoother? And if they can't come up with anything, that's a problem, because again, they can't recommend anything. They're not giving you they're not just alternatives, but they're not giving you the benefits
And
of a
actually,
synergistic approach.
and if they are the type of provider that you are, they'll get really excited with that question, right? Because they'll be like,
They'll be
"Yeah,
like, "Oh my
at
gosh,
37
great."
weeks, we actually do a naked rain dance." And
Right. I really do want you to go out into the forest and stand up, doing something wild. So
yeah,
yeah, yeah,
yeah.
and just all those aspects, and just, or when you ask them, especially during that labor and delivery, what is your approach with vaccinations? What is your approach with cord clamping? What is your approach? Like all those things that can happen during labor and delivery, because that's usually when all the high level interventions or the myriad
Yeah.
of interventions start approaching. Start researching like what could happen, not necessarily that it's going to happen for you, but find out what your physicians or that practice is approach is, or what their philosophy is in terms of the interventions at the level. Are they going to allow you to be moving around and free moving during labor, active labor? Will you
Mhm.
be allowed to be in any position that you want, or is it going to be you're going to be tethered to the bed? Is there mandatory treatments and medicines that your baby will have to receive? Or is there a window where you have time to think about it? Can you plan and
Yeah, there you
contemplate?
go.
Something
So
like that. So I think even if you don't know anything, the first thing to do is when you're doing that interview is ask them, like, what is their approach? What other
mhm.
interventions do they suggest? What intervention will make other interventions or modalities or services can they recommend that will make their pregnancy easier, or more, um make that journey in general
Yeah.
go by in a way that will help them achieve an optimal labor, delivery, and birth experience.
Do they cringe if you use the word journey? That's it. That's
Yeah, I mean, I tell everyone, like, pregnancy is just is one part of the journey, because that hopefully that child is going to be with you for a long time. It's not just
Yeah,
like the birth is the
yeah.
beginning,
I
not
know, but
the end.
I just think you're a lovely provider. You use the word journey in terms of
Yes.
the I love it. I mean, what doctor, you know. So is it reasonable to say that a client can expect to be able to have requests around their birth? Like if they say, I really, really want a filmmaker and two doulas and my mother-in-law in the room, even, if things start getting a little dicey, I don't want to ever have my mother-in-law out of the room or whatever your
Right.
desires are. Like, is that reason? Because so many people say, my doctor wouldn't let me. And I'm wondering from your perspective as a doctor, how far can a patient push requests like that and still expect to
Well, I think this whole COVID era that we're in now,
Oh yeah,
and
COVID,
as
I'm banking on that going away eventually.
yeah, I'm hoping banking all of it going away, because it definitely did change the birth experience for a lot
For
of our
sure.
patients who were expecting to have their doula and their spouse in the room. And it was very, very traumatic. That was a traumatic experience, knowing that, yeah, not only in the very, very beginning, it was no longer a doula or a
Yeah.
spouse, it was you, your birth attendant, and the medical assistants or the nurse that was helping you. So there was literally only 3 people in the room plus the baby that was coming. Um, and let's just say COVID era, outside of that,
Yeah.
pre and post, there are limits. First of all, the room is only but so big. Unless you're going to be delivering in your home where the space is what it is, the room is only but so big. So the more people that are in there means the more noise, the more distractions, the more moving
Well,
parts, the more people to manage. And some of those people are not at, necessarily advocating for you. They may be your
that's
best
true.
friend. They may be your spouse. They may be your mother-in-law or your mother. However, if they're making your process of labor and delivery more of a struggle,
Mhm.
or they're exacerbating a level of a relationship that has already been established pre-pregnancy or pre-labor and delivery, they may be your BFF, but if they're not helping you
That's
get to
true.
that end goal, it's really not beneficial for them to be in the room.
Well, what
So,
about like
you mentioned a
things like
filmmaker and everybody else, like,
yeah,
some of those people just like, yeah, it's they're more of a distraction for everybody in the room, and sometimes it can be also be a safety hazard, given that there's a lot potentially being a lot of moving parts and decisions that need to be made
that is an
at the
excellent
drop of a hat.
point. But what
Yeah.
about things like sorry, that was an excellent answer to a question that I didn't phrase very, very well, but that is excellent. But what about things like a delayed cord clamping
Yes.
or giving birth on hands and knees or things that
Yes.
aren't involving like how far can a mom push to say, I want the ability to give birth in any position and don't, whatever. Like how
Right.
far can
I
she
got you
push on
now.
those? Yeah.
That's where having a birth plan comes in. And so the time to start thinking about your birth plan and all the options and all the possibilities is the moment that you know you're pregnant. It's never too early. So you want to be thinking about the end in the beginning so that you have time to either change your mind, to get more information, and allow that process to evolve. You could find that, you know what? I really am not comfortable having, my being completely naked in front of everyone, and I really don't want to be on hands and knees. I really want to be able to, even though reclining isn't the best position to be in, but I really don't want to have that as you move
Yeah.
forward. Or you may find like, you know what? I love squatting. I want to have that birthing ball. I want to have that in this room for me because that's really where I feel comfortable. I'm getting the most opening of my pelvis, and that's really comfortable for me. And you may find out, okay, I want my one doula in the room, but I really don't even want my spouse in the room. Delayed cord clamping, all these things and possibilities need to be talked about. So, one, they're in writing. So, if they're in writing, anybody who's in the room can refer to it.
Mhm.
Two, they need to be communicated to not only your doula or your provider, but to the medical staff that is going to be on that floor while you're there. So it's as you come up with the plan, put it in writing so that everybody knows I don't want XYZ or I really do want X, Y, and Z. Please don't play a certain type of music because that stresses me out, but I really would like a lot of classical music. Can you please keep the lights dim because light sensitivity is not something that I really want to experience. Again, could you keep the movement in and out of the room? I don't really want to have a lot of digital exams. It's not necessary to check your cervix every hour. You don't have to do that.
Mhm.
You really don't. And just anything that you definitely know or you want to be able to eat throughout the course of your labor and delivery. Once you're in the hospital, some of that's going to stop because there's liability issues that they have to consider. So there's a lot of things that you will be able to do at home that aren't dangerous, but the liability is not being again placed on the hospital. So there's those things to keep in mind that there is a lot of leeway and a lot of space, but there are things that are hospital protocol for their protection, but not necessarily because they're wrong or that are harmful to you.
And even understanding the difference can take the energy down a
Yes.
notch on some of these, like,
Right.
"Yes, you're right. This isn't dangerous to you, but hospital protocol is this." So,
Yes.
that's cool. Okay.
And that's how you pick where your physician has rights too, because if you're going to be, for instance, delivering at a hospital where um, they don't allow delayed cord clamping, or that's not and it's something that you want to know that in the
Up
beginning
front, yeah.
versus, oh, I'm about to deliver in about 2 weeks, and now I'm associated with a hospital that won't allow me to do the thing that I have said that I definitely want to do.
Yeah.
And so it requires planning and interviewing your physicians and figuring out where you are going to deliver is going to be a big deal in terms of that whole process. So the earlier you start, the more questions you can get answered and the better you'll be able to plan accordingly for the foreseeable future.
Love it. Okay, last question before we
Okay.
close. Tell me more about the circles that you grew up with and the cultural practices and the rituals. Oh, I love the
Yes.
face she's making right now.
Oh,
And how you work those into your practice
yes.
and how it just brings yummy.
Well, in general, when I was blessed to have a great grandmother and a grandmother who I can remember and know, and
Wow.
along with my mother. I have two aunts and a series of cousins. So there was plenty of us to have these experiences with. And so getting my period, well, it was something that I wasn't really boiled over about because I was like, this is I was kind of a tomboy. Still am when I get rid
Yep.
I'm honest. I was like, this is kind of gonna slow me down,
Yeah,
and I
it's gonna get in
really
the way of my
don't really feel
mojo.
like is this necessary. Like, is this
It's really
that
is.
and wearing a bra were two things that I'm like, do I
You're
have to put this on? My boobs are like not that big, and they're really
right.
like this whole bra thing seems like it's just not
It's
necessary
kind of
right now.
yeah.
Um, However, once like you became, had that moment where you got your period, there was ceremonial, like, everybody came, there was a meal, there was preparation, and we were a non-douching household, so there was no douching to like clean you out. You were taught about menstrual blood and what it was and what color it should be, and all the ways that your menstrual cycle was a beautiful part of becoming a woman. And I was a late bloomer. I got my driver's license before I got my period, so it was one of
Wow,
those things.
that's
Yeah, it
cool.
was really late. The process, again,
That's
another
really
whole
convenient.
story. It was convenient for me, but not convenient for my mom, who thought I had like a myriad of things
Yeah.
going on. Because my aunt got her period when she was 8, so there was like that long span that was
Whoa.
like, oh my goodness, how do you deal with, my aunt was 8, and I was like, that's criminal almost for pretty much an 8-year-old. And I was like, if I don't ever get this thing, I'm cool because it's not slowing me down. Everyone else was like, I think you need to get her checked out. But I was fine. Everything was good. I was just really athletic. I was really active, and it just was one of those things that it didn't come early, but it was fine. And I've had a beautiful period ever since. I tell people all the time that I learned to really know what my menstrual cycle was about, how I
Mhm.
felt during each part, and that was because people took the time to really encouraged me about menstrual hygiene and talking to me. And that's where I learned about vaginal steaming. Because we weren't a douching household, we learned about vaginal steaming. And I'll just give you a little bit of a mini 101 crash course. We have I call it the throne, but it's a steaming seat. And inside is a pot filled with warm boiling water, and medicinal herbs, whether they're herbs for uterine that help with uterine blood circulation, um, stimulating the actual blood flow itself, all the different herbs for freshening, cooling, depending on what you need at the time. There can be different blends that are made, and we used to steam together as a part of that circle where we all get together after the end of your first menstrual period, and we sit and we talk, we tell stories about each other and each other's first experience with our menstrual cycle. And again, it would turn into like pregnancy stories and birth stories and just beautiful, awesome relationship and
Oh my
bonding and
goodness, I
family
love
gathering.
that.
And when there's always good food, I mean, you can't miss. And so
Yeah,
it was
food and
something
periods.
that,
Good. It's good.
yeah, I mean, food is medicine anyway. So
Right.
it was just one of those opportunities where we could all get together. And it wasn't, the whole entire family every time, but it was all the women in the family. And we just sit around and like talk and bond and connect. And while we're steaming. And so while you're having this completely relaxing and beautiful experience in with your undercarriage, you're also being able to fellowship and connect,
Okay.
partner with your family.
So what I'm hearing you say is that when you're young and you treat the first period with such honor and
Yes.
grace and kindness, then it's going to be almost impossible to then start treating the birth or womanhood in a gnarly ugly way because it's just not going to fit, right?
It's
I mean,
incompatible.
I
Yeah.
can't imagine you sitting around with your steams and talking birth horror stories, right?
Yeah, I mean,
It wouldn't have
it
happened.
doesn't really happen, honestly, and I can't I the first time I started hearing
Oh.
people having horror stories was when I was preparing to be a birth doula, and how, like, the before and after doula story, it's like, "Oh, this is what happened when I was in the hospital, I didn't have an advocate," and all those things, but you always have an advocate because no one's I mean, from my perspective in our family, you were never alone, like, your mother, your sister, your grandmother, your cousin, your somebody. I mean, my friends would come into our house to steam, because their families didn't do it. They were like, "What is that about?" Um, and it was just great. And like, kids in our neighborhood, when they got their period, they're like, "Oh, we're gonna go to her house because they do this thing." Um, and everyone kind of got on board, and was wound up being like a really community activity, of women's health and just other women who really wanted to take care of their bodies and treat
Wow.
this experience like it was the miracle that it is, because it is a beautiful opportunity for ceremony, community, love,
I love
and
it.
just ushering in womanhood.
So even if you didn't grow up like this,
Yes.
women's circles is you're going through your pregnancy and just
Yes.
surrounding yourself with a community of women who can tell you good stories. I say you can't unsee a good birth. Like
You can't.
it goes to the deepest
Yes.
parts of our brain, and so watch a ton of good birth videos.
Yeah. And even I was a centering pregnancy facilitator, and it was where you went through your whole pregnancy in a group of like 8 to 10 women. And it's not
Ooh,
for everyone,
neat.
obviously, because some women just don't want that experience, but some women need that experience
Yeah.
based on either lack of community or lack of family or lack of support. And just having that 8 to 10 other women to, in addition to your provider, to help support you and talk you through all the anxieties and the worries and the concerns, but knowing that, oh, there's 9 other people who are pretty much at the same place in their
Yeah.
pregnancy that you are, just being able to have that. And that's kind of the idea of that whole women's circle. It extended to a specific time in a woman's life during that pregnancy period as well.
Love it. Wow. I am so sad that we don't live closer.
Yeah,
I
I
would
mean, it's by the time
man.
we get to where I want it to be, there's going to be at least one everywhere that hopefully will be accessible to so many other people.
Well, if you're looking for an extension office, Salt Lake City, we're ready for you. It's just
Okay, got
right
it.
here.
Got it.
I can help you,
All
hook you
right.
up with great space. Yeah. Oh
Sounds
my goodness.
good.
I just thank you so much for taking the time to
Absolutely.
just
Thank you
share
so much.
this.
I
Yeah.
appreciate it. I really do appreciate it. And again, anything that we haven't touched on, or you're concerned or you're interested in, I did write a book, and pretty much
Oh yes, that's
all of them
perfect.
are in there.
Natural. No, hold
Um,
that up again. Natural
okay.
Pregnancy Guide: Empowering Moms to Make Healthy Choices by Dr. Laurena White. Awesome. They can find that on Amazon.
Right on Amazon, and everything that we've talked about, and even from the birth circles and the women's health circles and vaginal steaming and all the different like questions to ask, which you don't know what to ask for, and like the choices that you have, the birth plan, all of that is in there.
Awesome. And what is your website and your Instagram, everything?
Website is my first and last name, www.laurenawhite.com. And Instagram is the Eudaimonia Center, all together, THE, Eudaimonia, EUDAIMONIA Center. And the same thing on Facebook, the Eudaimonia Center. And the same
Awesome.
thing on, I think, on Twitter as well.
Perfect. Again, thank you very much. This has been so informative.
Great. Thanks so much for allowing me to like nerd out a little bit, because
Oh, yeah.
I like to go there.
Awesome. Thank you.
Thank you for the invitation, Sarah, and have a wonderful one.
Please visit us at birthcircle.com, join our Facebook groups, or find us on Instagram and Pinterest. We hope you'll use our resources to support your birthing experience.